We have the final 8th pitch, addressing the technology gap. This is Team Digi-Ease.
Welcome to Digi-Ease, a digital technology for your healthcare needs. It's a pleasure to be here and to introduce our team, Larry, the CSO, Ellie, the CEO, and myself, Marianne, the CPO. And I have a question. Okay. And I have a question for all of you. Thank you. I have a question for all of you. Do you have any elderly dear ones? Having some problems here. So, do you have any dear ones who have diabetes, who suffer from diabetes? Raise your hands, please, if you have any relatives who suffer from diabetes. Another question, do you have some elderly in family or dear ones who suffer from cardiovascular diseases? Raise your hands, please. Then we're standing on the same ground. And this has an impact on us. Our dear elderly, when they go to the doctors and have their consultations, they sometimes suffer from miscommunication. They can't get what's, the prescription. They can't remember. The doctors are not, talking in a simple way. And above all, they need our care, their children, their relatives. And this has stress on us because we are very stressed in our own life. We have some goals to fulfill. We have some family to care about, a lot of family. And we always have, I'm not sure if you share with me, that feeling of guilt towards those precious persons. And that's why we need to do something. What shall we do for those persons?
Here's the solution, Digi-Ease, a digital health platform empowering you to care seamlessly for your loved ones. So how does it work? Let's see where the problems lie. So it's here. We start from patients. Patients, they don't really understand what the doctor's talking about during consultation. Doctors, they keep being bothered by questions, by calls from family members, and family members, they don't really know what's going on with their loved ones, and they keep worrying about that. So we have this platform, a digital health platform, Digi-Ease, to connect all of them into one app. And here, this is how it will look like. So at the very top there, user can see who is sharing the data with who, and under that, they can see the patient's current condition, including glucose level, exercise level, diet, and also drug compliance. And we're offering 5 platforms. So these 5 platforms are designed upon our quick survey in Indonesia. So we have electronic health record, we have video consultation, enable patients to remotely consult with doctors, and we have reminders, we have lifestyle monitoring, so they can monitor and design what kind of lifestyle changes that can work best for the treatment. We also have emergency button. And for the next one, you can see the reminder. The reminder will work to remind patients when they have to take drugs and when they have to refill the drug. And also to remind the patient when is the next doctor's appointment and what they have to do before the appointment. And here, they can input the data of doctors and medicine that have to be taken. Most importantly, here is the data sharing platform. So we want to enable users to access the data so they have the tools to know what's happening with their loved ones. So it will reduce all of their worry. So we really want to enable them to use all of the information so they can turn their worry into care. Next.
How about competitors analysis? So Digi-Ease have a distinct advantage in terms of pricing. We can see that Digi-Ease do not require the end users to purchase the hardware. This will bring down the cost. And also, there being a software-only platform, this offers an ease of use. And most importantly, there are the last 2 points, interaction with the next of kin and the emergency button. Majority of the competitors do not provide this, but even if they do, they require the end user to purchase the hardware, which can cost up to 100 or 200 USD. For revenue streams, our primary revenue streams would be the subscription-based model, we are charging $1 per user per month, very affordable. The second and third revenue stream would be generated when the diabetic patient purchase the nutraceutical products from the companies and also the drugs from pharmacies online. And the fourth revenue stream will be the mobile advertisement platform on our Digi-Ease app. And we are targeting the Indonesian market. Now, why Indonesia? Indonesia has around 10 million diabetic patients, and with an average of 2 children per family, we are looking at over 20 million potential users. And mind you, I'm only talking about Indonesia, one country alone. Worldwide, there are 420 million diabetic users, and this represents a large untapped market for the Digi-Ease app. So our team has a concrete plan to reach our milestone. Towards the end of 2018 and 2019, we would have the minimum viable product and a fully developed product for the Digi-Ease app. And this can be accomplished with the money raised from the pre-seed, seed, and the Series A funding. Towards 2020, we will start to extend our reach into the international market, seek to go global, and at the same time, we also have a fully developmental product for the cardiovascular app. So in order to fully tap into all the diabetic population around the world, we will have to collaborate with several organizations such as the PERCUNDI, which is a local diabetes organization, and also the International Diabetes Federation. This also helps us to tap into their network of the vast diabetic population and also enables them to share with the patient what are the benefits of using the Digi-Ease app. Of course, the user acquisition, towards the third quarter of the 2020, we should see hit around 1 million users, and towards 2022, we should hit around 1.6 million users. And obviously, this user acquisition will translate into profits. In the year 2020, we should expect to hit $10 million net profit, that is minus off the cost of goods sold, expenses, and marketing. And finally, towards 2020, we'll have $60 million of the net profit.
And yes, you are right, Larry. It's not only about having financial profits, it's something good, but we really care about loved ones. Our slogan is sharing is caring, and Digi-Ease is a digital health platform that empowering you to seamlessly care for your loved ones. Thank you very much.
Thank you very much. What kinds of risks do you think, what do you think your most important risk is?
Can I answer that? Oh, the most important risk would be the HIPAA, which is the regulation. Right. So in order to safeguard that, we should have HIPAA compliant measures. So in terms of that, we should have the technical, administrative, and the hardware safeguards. So we seek to engage this company called the VoT, which are able to enforce all these 3 safeguards in place. And they are charging like $2.5K a month, and then we'll have like HIPAA compliant measures in place.
And why diabetes as your starting point? It seems like a platform that you could use for any sharing and caring.
Sure. I should say that in Indonesia, diabetes is a huge problem. We have 6% of the population with diabetes. And it's also about our expertise. So I'm doing my master's dissertation about pre-diabetes, and Larry is also PhD doing diabetes. So I think we want to enter something that we're familiar with a clear demand of the market in Indonesia.
What is your main strategy in marketing to penetrate into the market? Obviously, it's very big, and the people do see the benefit of using it if they get to the habit of using it.
Sure. So we plan to partner with the local partners there. We identified 2 local partners, and we want to have them as the marketing channel. So we have the way to reach the patients, to reach the users actually. And we also did a quick market survey to Indonesian, which they have family members with diabetes or cardiovascular disease. And from the surveys, we see that most of them, they want to use this platform, this app, and they think that this is very useful. Also, with our subscription fee, that is affordable for them. So there is a clear benefit from there. We will reach them from the local patients, expert organizations. So I think that's probably, hopefully answered the question.
I'm not quite clear from the presentation. Are you planning for the data to be kind of self-entered into the smartphone, or is it going to have a link to a glucose monitor and then have some automatic access to other patient information records?
So the data can be inputted two ways. The first way would be after the medical consultation with the doctors. The doctors can key into the hospital system, and we can access this information as well. So the other way is the next of kin, which is the loved ones can also input this. For example, they can take the glucose testing system, get all the data, test it for the patients, and then input them themselves.
What is your integration strategy? You're going to have to integrate a lot of different data sources together and harmonize them in order to present the data in a dashboard format. You're going to have APIs, and I could just go on and on about the data part.
Do you mean getting for the electronic health record, for example, if we have the glucose measurement and the food intake and everything to
Yes, like
just
the wearables, you know, you have to wear wearable data and integrate with lots of different kinds of wearables to get certain kinds of data in and so on and so forth.
At the beginning, we'll make it very simple. The minimal viable product will have the simplest features of being able to scan the medicines and scan the results of like the glucose tests and other stuff. And at the next phase, we'll make the features more complex, like integrating with hardware, but making sure that the hardware is not that expensive because we want to target the biggest market. And this is one of our points of excellence. As Larry mentioned, we don't want something to be expensive.
No further questions. Thank you.